Hi, my name is Saira Khan. I'm a digital program management consultant with Surrey and Borders NHS Foundation Trust. I'm delighted that we've been given the opportunity to present our project Pathway Navigation to you. We believe that this has made a real positive difference to our service users, and it's made the lives of our staff so much easier. As a digital program manager, as a digital lead, working with clinical and operational colleagues, I'm passionate about user-centered design, a humanistic approach to program and digital design that really puts the user at the center of everything that we do. And this project is a brilliant example of how we've been able to come together and really put the user at the heart of our design and design something that actually works in a fast-paced clinical environment. So I'm going to now hand you over to my colleague Tam, who'll introduce himself.
Hi, I'm Tam Dera. I am Locality Associate Director for the Northwest Locality. I also work for Surrey and Borders, and we've been working in partnership with our digital team, and my colleague will be introducing herself later. I'll be back to talk to you a little bit about the benefits that we've realised during the course of the project. And I'll just hand you over to my colleague Shahida.
Hi, I'm Shahida Suji. I'm the Locality Director for the East Locality and Tam's partner. Really excited about this project, and I am ready to go. The whole idea was, the challenge for us was how we would implement a single system for tracking a service user across their treatment journey in a largely geographically diverse trust, in which different teams had created and embedded their own paper-based system. The solution was to provide the benefits below: universally accessible, information secure and patient confidentiality being protected. It was needed to be easy to use, real-time viewing and reporting, and to show accurately where each person is in their journey and how long they've been waiting. The next slide, please. The approach was clinical, operational, and digital colleagues collaborated and co-designed a solution that was thoroughly tested in a live, time-pressured clinical environment. The team used a hybrid of Prince2 agile methodology. The proposed solution was iteratively developed based on feedback from staff within the service, and time was taken to roll out and embed the solution to ensure that the teams would not revert back to their paper-based solutions. There was a strong emphasis on ownership from both clinical and operational colleagues. Thank you. I'll pass you on to Saira.
Thanks, Shahida. So it was really exciting coming together with clinical, operational, and digital colleagues. We formed quite a large team. We were faced with a number of constraints. The first and key constraint was that we had to find a solution within our trust electronic patient record system, System 1. So we had to be very pragmatic in our approach. And the final solution utilized the waiting list functionality within System 1. We also created real-time dashboards to provide a view, not only across a team, a cluster of teams, but also across the whole service, so that different levels of staff and the management team could drill down across different sizes or different localities. But also we made sure that the dashboards were linked back to System 1. So if there was a concern that a person had been waiting for a long period of time, we could look at the dashboard and drill back down into their record in System 1 to really understand more about what's happening there. So I'm going to pass you over to Tam, and Tam is going to talk about the benefits that we've realized.
So the solution achieved quite a wide variety of benefits and basically provided real-time visibility of where the person was in their treatment pathway. Whether they're waiting various treatments, it could have been assessment, it could be their first treatment, it could have been an intervention, whether we're waiting for the person to be allocated to a clinician to support them. There were other waitlists that we developed around whether somebody was waiting on a review-only waiting list or a waiting discharge waiting list. And what the system enabled us to see was how long the person had been waiting on that particular waiting list. So this was the first time we were able to visibly see how long people were waiting along their patient journey, and it's proved really beneficial for us through the time. So other benefits that it brought was that staff having the confidence in utilizing a system that they've designed and have been willing to stop using their paper-based processes. So we managed to get rid of all the paper-based, well, almost all of them, but the majority of the paper-based processes, we managed to stop staff using those. There was a reduction in the time taken to discharge people. So, and that was discharging people back to the care of their GPs. Many teams now are discharging over 50% of their people on their caseloads within 7 days, compared to an earlier average of about 23 days. And what that means was that when somebody was from the point of discharge, it usually take clinicians up to 23 days to actually discharge them from our system, whereas now the turnover is within 7 days. So that's a really positive benefit for the teams. And additional to that, it meant a result of the caseload actually being reduced in terms of numbers on our caseload. The average number of days that a person is waiting before being allocated to a clinician has also dropped by 50%. And this is a really tangible benefit for the service users. Because before, sometimes people would get lost on the paper waiting list, and then it's only after somebody calls to request what's happening with their care that people will then get allocated. So this has been a really tangible benefit for our service users. The solution has also remained quite static, but has also evolved as the needs of the service have grown. And that's been a really positive benefit, because I think people have seen the benefit of being able to see people on different waiting lists, and that's actually evolved the system. So at the start we had, I think we had about 7 waiting lists. I think now we've added an additional 2 over the period that wait lists have been used. Next slide, please. The final benefit, I would say, is that the solution places SABP in a great state of readiness to manage, monitor and report on national waiting times, which NHS England and the Department of Health wish to roll out across all mental health services. So that does make us a pioneer in what we've done with this particular system. I'll now hand you back to Saira just to talk about the next part of our presentation.
Thanks, Tam. So working collaboratively with clinical and operational colleagues was key. We wanted to ensure that our colleagues who are actually going to be using the solution were empowered. They were a key part of the design workshops. And we also built in extra time during the project so that we had plenty of time to roll out to a team and really learn from their experiences of using it live, so that we could iteratively keep developing the solution. I think in total, during the whole course of the rollout, there were 14 different iterations, but the end result was so much simpler and slicker to use. It really shows that when you do involve the users in designing a solution, it really works. And this is some of just some of the great feedback that we've had from operational colleagues. So a lead administrator from Tandridge has said that she loves that you can get interrupted and go back and easily pick up where you left due to the online notes and the visibility of all the patients. A lead administrator from Mole Valley said that since it's been introduced, they are really able to keep on top of their caseload in a far more organized manner. And a service manager from Reigate and Tandridge has says that this is one of the projects that I can confidently say that we were made to feel a part of the actual design, and we was involved in the journey together rather than something that was just imposed on the team and not fit for us in practice. The way this project was managed was impeccable, as it allowed us to have a regular check-in conference calls and workshops to tweak and make and refine the changes as a rollout was being implemented. Adopting such an iterative approach was unique, it was different, really making sure that we had strong change and adoption leads and embedding the solution meant that rather than front loading the project with resources for the design phase, actually we focused resources in the rollout, embedding and the iterative development. It meant that the project timelines were slightly longer, but we're confident that we've delivered a solution that actually works in a real live clinical environment. the solution has evolved to continue to meet the needs of the service. And most importantly, it's a solution that's actually being used every single day and is a solution that is mitigating clinical risk. It provides great visibility of who is waiting where in real time. And that view is shared. So it's not in someone's diary in a drawer, but it's on our clinical EPR. It can be accessed by all those who have the right accessibility, and there's visibility. And that means visibility gives much more proactive management. So we're confident that we've delivered a solution that really works for service users and our staff. And we really hope that you will vote for us to achieve this award. If during the conference you have any questions or comments or suggestions, please don't hesitate to get in touch with us using the chat function. We look forward to hearing from you. We look forward to receiving your vote, and we really do hope that we will receive this award so that this kind of solution and the approach that we've used can be utilised again and again in the NHS, because we are evidence and we can strongly validate that it definitely works. Thank you very much.